Good evening, everyone, and welcome to the 17th installment of Science Stories. This speaker series highlights the work of science journalists, authors, illustrators, filmmakers, and other professionals who bring science to life through storytelling. It's brought to you by the McMaster Alumni Association and the School of Interdisciplinary Science. I'm Katie Moyse, an associate professor in the school and your host for tonight's event. It is my absolute pleasure to welcome our speaker, Dr. Richard Besser. Dr. Besser leads the Robert Wood Johnson Foundation, a leading health philanthropy in the United States focused on transforming health in our lifetime. He joined the foundation in 2017 as president and CEO and brought with him a wealth of experience in healthcare and public health leadership. Dr. Besser, a pediatrician, was acting director of the U.S. Centers for Disease Control and Prevention, the CDC, in 2009 during the H1N1 flu outbreak. He went on to become chief health and medical editor for ABC News, covering outbreaks, cutting-edge research, health policy debates, and the personal stories that connect us, regardless of where we're from or our political leanings. Rich, you were my mentor for many years when I was a health journalist at ABC News, and I still carry with you your calm, careful, and compassionate approach to honest, transparent, and inclusive communication. Before we dive in, I want to remind audience members that this fireside chat is being recorded and emphasize that it is meant to be an informal discussion and not to be quoted in the media. If we have any members of the media interested in speaking with Dr. Besser, I invite you to reach out to him directly at the Robert Wood Johnson Foundation. And if any audience members have questions for Dr. Besser, please use the Q&A function at the bottom of your screen to submit them at any time. We'll get to as many as we can before 8 o'clock. Dr. Besser, thank you so much for joining us this evening.
Katie, it's absolutely wonderful to be here. Please call me Rich. When you reached out about this, I felt honored, and it's wonderful to spend a little time in conversation with you.
Oh, amazing. Well, I'm really looking forward to this hour together. I'm wondering if to start, you can tell us about your role at the Robert Wood Johnson Foundation and how your work in healthcare, public health, and health journalism led you there.
You know, it was a pretty windy path to get to the Robert Wood Johnson Foundation. So I'm the president and CEO of the foundation. I've been in this role for almost 8 years. I can't believe it's been that long. Um, but my career has involved a lot of different sectors. You know, I've always been passionate about the power of public health to make a difference in people's lives. As you know, I'm a general pediatrician, and up until a couple years ago, I continued to see kids in clinic a half day a week, and I love that. I love the personal interaction, getting to know a child and their parents, their concerns. It also was really valuable in terms of my work in public health at the CDC, my work in journalism at ABC, and my work here in philanthropy at RWJF. Because the when you think about the power of public health to impact people's lives, what you want to look at is those people in society who are the most marginalized, those who are the most challenged by the systems and structures that favor some and disadvantage others. And a great window into that is in federally qualified health centers. So in the United States, there's a whole network of community clinics that are supported by the federal government that provide free care or subsidized care to people who either have no insurance or frequently in government provided insurance like Medicaid. And so getting to know people, you gather stories. And you know, I'm an epidemiologist by training, and so I love data. Data speaks to me, and I've learned that data does not speak to most people. And so finding stories that illustrate data has been a theme really throughout my career. But how I got to the Robert Johnson Foundation, uh, like most of the career decisions in my life, it was not a planned decision. You know, I thought that I would spend my career working on global health around the world, and trained as a pediatrician at Hopkins, connected with people at the School of Public Health at Hopkins. And my mentor there hired me to go work in Bangladesh for a year. And this is it. This is what I'm going to do. I'm going to be an expert on diarrheal disease. I'm going to work on diarrheal disease for the rest of my life. It didn't work out that way. I went to the CDC to learn to be a disease detective. And on the first outbreak that I went on, it was up in Massachusetts, 6 children with kidney failure that I traced to apple cider. On that outbreak, I met Jeannie, the woman I married. And global health was then not the direction we were going to go. And so, it's been a windy path, and we can get into a bunch of that. But it's all been at each juncture, it's been looking for opportunities to learn, to grow, to contribute to things that I thought had value and would hopefully improve the lives for people here or around the world.
Thanks, Rich. I had no idea that that's how you met Jeannie. I'm curious about that. I also
There's a
I
good story
yes,
there.
I love that you mentioned finding stories that illustrate data, and I really want to come back to this idea. But before we go there, I want to stick with sort of the mandate of the foundation for another little while. The foundation aims to ensure that health is no longer a privilege but a right, by dismantling some of the biggest barriers to health, especially structural racism. And I wonder if you can talk about the importance of this mandate. And you talked about sort of marginalized people, and the importance of public health. And so the importance of this mandate in the context of some of the challenges posed by today's political climate.
Yeah. So the foundation has been around for over 50 years, always focused on health. When I came 8 years ago, we were focused on what we called a culture of health, which was a recognition that health is about more than healthcare. Yes, you need to have access to high quality, affordable healthcare, but so much of our ability to lead a healthy life depends on the communities in which we live and what's available there. Are there good paying jobs? Are there good schools? Is it a community where you can go outside and play? Are there parks? Those are critical features. And as we dug into that, the issue of equity became front and center. And by equity, we really are talking about the opportunity for those things. Who has the opportunity to lead their healthiest life and who does not? Who faces barriers? And when you think about the barriers to health in America, big barriers from racism, from sexism, classism, barriers due to sexual orientation, where you happen to live. But in America, the biggest barrier to health is the barrier from structural racism. And it pervades every single system that we look at in America, and it can determine whether someone will lead a healthy life or not. The foundation's located in Princeton, New Jersey, and if you are born in Princeton, New Jersey, you have a life expectancy of 84 years. I was working at a community clinic in Trenton, which is 14 miles down the road. It is in the same county. And if you're born near my clinic, your life expectancy is about 14 years less. And so looking at, well, why is that the case? There's a lot of different reasons, but the barrier to opportunity is driven heavily by race. Our history in America of racial segregation that was enforced through government law, through community covenants, all kinds of features have ensured that in America today, who you are, what you look like, where you live can determine a lot. So as a foundation, we took a big turn in 2020, and it was a result of a number of features. One was our increasing recognition that equity was the driver for health. But also, it was the time of COVID. And when you looked at how COVID was hitting populations in America, how you did in COVID was again very much determined by race, by geography, by class. But race was a big driver. Who was more likely to work in a job where they did not have sick leave or family leave? Who worked in a job that was more likely to pay minimum wage and did not have health insurance with it? Who was able to follow CDC guidelines that said if you get symptoms, isolate yourself in a separate room. It was clear that there were a lot of racial differences there. And at the same time in America, we were facing a racial reckoning following the brutal murder by police of George Floyd. So those two features together allowed us to pivot and say, as a foundation, we're going to focus on changing the systems and structures that really enforce a hierarchy of value and worth in America by race. And we have taken a turn, and that has been our focus. And we have aligned around systems change, policy change to drive that in a number of domains, community development, our healthcare system, our public health system, our tax system, which is loaded with all kinds of features that favor white people over others. And that's been our big driver. Your question about in the current moment, it's more challenging. You know, in America, at the same time we were taking a turn to focusing on structural racism, there was a brief period where we were actually talking about race and racism in America. And we were seeing the private sector, the public sector, all reckoning with this and talking about who has opportunity. We talked about issues of equity, of diversity, of inclusion, of leaning into the promise of America and the values that we hold dear. But it was almost a blink in time before there was reaction and backlash and a lot of organizations and institutions moving away and saying it's too hard. We're not going to do that. We as a foundation have not done that. We've leaned in, and in this moment where we have an administration that is really tearing down so many aspects of civil society. We are saying that we are continuing this work. We're supporting our grantees. We believe in the promise of our nation and what it could be, and we are fighting back. And it's hard, but it's so important to know what your values are. And I feel extremely privileged as a white man, an older white man, leading this organization with a board that is supportive to be able to say we are staying true to what we believe is the right way to go.
Thanks, Rich. I want to highlight a public message that you wrote earlier this year. You said, "What a time we're in. The Trump administration's vicious retrenchment on the policies, progress, and words, diversity, equity, and inclusion has severe consequences for health in America." You addressed head-on the hostility of the Trump administration. You didn't mince words in that in that message. You haven't minced words here, and you've gone on to reaffirm the foundation's mandate, promising bold leaps even in the face of hostility and obstruction. To quote your message, I speak to many clinicians and scientists in my role as a journalist. And some are afraid to go on the record about the damage being done, in science and in healthcare. I'd say across society, this is probably true. A lot of people afraid to talk, a lot of people being blocked from talking,
Yeah.
even by their institutions. And I'd love to hear your thoughts on this, the risks of speaking out, and the risks of staying silent.
Yeah. It's each of us faces different levels of risk. And so I want to acknowledge that. I have colleagues in philanthropy who would be much more likely to be targeted than I would because they are women, because they are people of color. They're more likely to be called out in this moment. Um, I do think that the overarching approach of duck and cover maybe we won't be seen and things will be okay is the wrong approach. I think that this is a moment for us to band together and say that this is not normal, this is not acceptable, these are not the values that we lift up as a nation. And we're going to do all we can to push back. We support a lot of legal efforts. Some have been successful to slow down some of the measures that have been taken by the administration. We are nonpartisan. It's the issues that we care about. When I think about the COVID pandemic, which was uh, such a devastating event to the whole world. There were aspects of the response to that that were absolutely miraculous. The idea that we had several safe, highly effective vaccines in about a year after a totally new infectious agent was discovered, that was miraculous. And it was something that was accomplished by the Trump administration that said, we are going to support this. We have Operation Warp Speed. We're going to make this happen. It was built on the backs of decades of basic science research by the National Institutes of Health and others around the world. That was funded by tax dollars, but it was that investment in science that allowed that to happen. The idea that the administration now is stripping all of this funding from the National Institutes of Health, is stripping funding from the CDC and from FDA. This will leave us in an incredibly vulnerable position the next time a pandemic arrives, because it's not if, it's when we have the next pandemic. It's, when you had mentioned that I was the acting director of CDC in 2009, when we had the H1N1 swine flu pandemic. We were really lucky at that time that it wasn't more severe. Luckily, it was a strain that wasn't so severe. Public health around the world is keeping track of a strain of bird flu now again. Who knows if that's going to change into a strain that could cause a pandemic, but it could. The idea that we have a Secretary of Health in the United States who is one of the leading proponents of misinformation around vaccines, spreading fear and mistrust in what I found as a pediatrician was the most important thing I could do, was getting kids vaccinated on time and fully. The idea that we have a Secretary of Health who's doing all he can to undermine that means that the next time we have a pandemic or a public health crisis needing vaccination, we as a nation are going to be in big trouble.
Mhm. And you're absolutely right. It's not a question of if, but when. Um, You have been a prominent public health figure for many years, across several public health emergencies. Like you just said, you were acting director of CDC during the 2009 H1N1 outbreak, chief health and medical editor of ABC News during the 2015 Ebola outbreak in West Africa, as well as an outbreak of Middle East respiratory syndrome caused by a coronavirus before most of us had even
Right.
heard that word. And you were a prominent media figure throughout the COVID-19 pandemic, doing many media appearances. What are your priorities when communicating health information with the public during fearful times?
Yeah. Um, I'm a big believer in the power of communication to instill trust, as well as the power of communication to absolutely destroy trust. When I was at CDC, one of the jobs I had for 4 years was I was in charge of emergency preparedness and response, and I started that on the day Katrina hit New Orleans. And then I was in similar roles until I left during the H1N1 pandemic. And there's a science to communication, as you know. It's not just, oh, you just get up and say something. There's a lot you can learn about how you do risk communication, how you engender trust, or how you undermine it. And I took every class I could take on risk communication. Every time there was something offered that involved the theory as well as the practice, getting in front of a camera, learning to talk to an audience in front of a camera. As a pediatrician, you learn a lot about how you can either create trust or undermine it. And a lot has to do with the ability to really listen and empathize and understand what people might be feeling, and to address that. When it comes to risk communication, the theory says when people are stressed, they don't take in as much information. So you don't want to overwhelm people with too much information. You need to repeat information so that people hear the same thing over and over and over again. And during the swine flu pandemic in 2009, one of the things that we did was we put communication and our approach to communication as one of our critical strategic areas to address. So every day, in the morning and in the evening, I did media and held press conference just about every day, addressing the questions that reporters have. Because in a time of crisis, people want to know, what you don't know, and what you're doing to get answers. And if you can do that and give people information that they can use, it will empower them to make better decisions about their life and their health. And one of the things that I'm proud about at that time was that the CDC commissioned polling from the Harvard School of Public Health, and what they found was that people's trust in government was higher than had been seen for any other public health crisis. And I think it was a direct result of the approach we took to communication. And it's pretty much the opposite approach to what was taken during COVID. And the consequences of that, where you weren't seeing trusted public health leaders out front, you were seeing political leaders driving the conversation, was that people's willingness to follow public health advice broke on political lines. And that is true to today. People's trust in public health in the United States it depends greatly on what political party they're affiliated with. One of the things that was clear to me when I was running emergency response at CDC, it was during the Bush years, so it was during a Republican administration, was that preparedness and public health response was something that was nonpartisan. Both parties agreed that this was critical to the health and safety of our communities. There might be different approaches to talking about it, but it was something where we came together. Whenever there was a public health crisis, we came together as a nation. And it's something that broke down with COVID, where we saw intentional politicization of the response and demonization of public health and the people who practice public health around the country.
Yeah, yeah. As well as journalists too. um,
Yeah, that's
sharing
right.
and yeah. You mentioned the importance of sharing what we know as well as what we don't know. And this is something I've always really admired about you, the transparency with which you sort of talk about health research as being something that evolves. And I think one thing that I heard from a lot of folks during COVID was, that things were always changing, advice was always changing. And I wonder if there's sort of a lesson to be learned from that about how best to communicate such that we're sort of, reminding people that things can and will change as we learn more.
Yeah. Yeah. When I was running the CDC during that period, for my press conference, I started them all the same way. I'm going to tell you what we know, what we don't know, and what we're doing to get answers. Some of the things that I tell you today will change as we learn more, and that's a good thing. So keep track of the recommendations, because as they're changing, that means that we're learning more. And as we learn more, we're going to tell you. And we're going to tell you those things that we told you before to do that are no longer correct. And that may seem like we don't know what we're doing, but actually that is science working to improve the health of everybody. That got lost. And not just got lost, but it was deliberately used by some to undermine people's belief in science and public health. I think at times as well, people who were speaking from public health positions did not always say that this information is likely to change and stick with us. And as it changed, sometimes the messages in terms of what to do didn't change fast enough. But there's that relationship of trust. When you've got it, you have to do everything you can to hold on to it because once it's broken, it can be extremely hard to regain.
Yeah. Um, on the topic of regaining trust, I think, there's this is maybe an an interesting piece of sort of history in research. We now have a resurgence of measles, and a Health and Human Services Secretary, as you mentioned, RFK Jr., with a history of promoting anti-vax conspiracy theories, including the extensively debunked link between the MMR, measles, mumps, and rubella vaccine and autism. And this link, it was sort of it was supported by a 1998 study that was eventually retracted. But you mentioned sort of once we've lost trust, it's really hard to get it back. And
Yeah.
I think we're still, experiencing this and in a really impactful way. So how do you address public fears about vaccination or anything else that are, are not unfounded,
Right.
right? But increasingly fueled by political leaders as well, about things like vaccines.
Yeah. Yeah, it's a real challenge. It's something that I've addressed from each of the different seats that I've had. So as a general pediatrician, spending a lot of time with parents, hearing their questions, addressing their questions, creating space so that they felt comfortable asking questions. Because if you have a parent, a patient who doesn't feel comfortable asking questions, they may be nodding in the room, but when they leave, they're going to say, "I'm not going to do that." He didn't address what I'm concerned about. And so that relationship is really important. And all the surveys show that people's relationship with their healthcare provider is one of the critical pieces. At CDC, one of the ways that we work on building trust is having a really open process around how vaccines are evaluated and approved and recommendations are made. There's an advisory committee that's outside of the CDC called the Advisory Committee on Immunization Practices. And they meet and they review all of the science around a particular vaccine and then determine whether or not that vaccine will be recommended for use and for whom and at what ages and what schedule. Those committees are webcast so people can watch them or they can go on and they can read, but they're open and you can see in that setting all the questions that are asked. So that was really important. Then when I was at ABC, I went to ABC as a way of practicing retail public health. So direct to consumer, I was really excited during H1N1 at how trust was so high because of communications. And so I went to ABC to try to do that on the air. And I covered vaccine related issues of a fair amount. I went out to California and reported on measles outbreaks that had started after some kids with measles came in and went to Disneyland, and it spread. And I went down to San Diego and reported on the spread of measles there. And the challenging thing is to make it human. And so you're looking for someone who can express, their concerns, why they don't want to vaccinate, but also trying to put a face on why vaccination is so important. And there's a mom who sticks with me. I wrote about her in a book my wife and I wrote when I was at ABC called "Tell Me the Truth, Doctor." And she was a mom. She and her husband had a hard time getting pregnant, and they had a couple kids, but they were trying to have another. And finally, they were successful, and they had a baby named Callie. She was a little premature, and she went home. And after about 3 weeks, she developed a little bit of a cough. And they saw the doctor, and the doctor checked her out and said, "Well, we don't think it's much of anything," but it kept getting worse. And she came back, and she was diagnosed with whooping cough, and she ended up dying from whooping cough. Not because her parents were anti-vaccine, but she was too young to get vaccinated. And so, while we can talk about vaccination being an individual decision, and no one in the government is holding someone down and vaccinating them, we have to talk about the value of vaccination, not just to protect ourselves or our family or our individual child, but the fact that we vaccinate to protect those around us who can't be protected. Either they're too young, or some people have medical conditions where vaccines don't work. And that's really important when we talk about measles. Measles is the most contagious virus that we know of. And if you have, just five kids out of 100 in a community who aren't vaccinated, that's enough for it to keep spreading through. And what you tend to see is that people talk to each other. So while across the nation in the United States, something like 93% of children are vaccinated, in some communities, like part of Texas, that are seeing this outbreak, it's only 80%. And that's enough for it to whip through. And so anyone who's truly vulnerable for measles, it's really concerning. And so how do you make the case that part of being in a society is that we do things for each other, not just for ourselves, but for each other, and it's part of being a part of a community. And I think you bring that to life by telling stories and letting people meet those who are affected. Callie's mom has gone on to become a major vaccine advocate. She tells her story all over the country, and it helps convince some other people to say, you know what, I think I'm going to get my child vaccinated. You're muted.
Sorry.
It's all
Oh,
right.
thank you. I remember coming to you when my son Gus was 6 weeks old. We were traveling home for Christmas, and we were going to be with some other kids that were older and weren't vaccinated. And I remember coming to you and asking for your advice, and
Yeah.
just being so grateful for you and for the way that you listened and understood my fears. And yeah, that just came to mind. And so when you talk about sharing Callie's story, that's an example of, putting bringing data to life. Right? Like we know that this can happen. We know the numbers of possible, like we know how many kids that are below the age of vaccination do get sick. We know how many die. We have really strong data, strong evidence that supports vaccination and all kinds of health behaviors. But we can also hear really compelling stories of that are the rare exception. And especially during COVID, those stories really took off. Right? So where we're not hearing about sort of the 98% protection rate, but we're hearing about maybe the really rare vaccine injury, which of course is possible, but is
Yeah.
exceedingly rare. But those stories really get out there. So I wonder if you can talk about sort of what we can take away from this. Yes, putting faces to data, but what about those exceptions, and how do we sort of temper fears around those sort of N of one, for lack
Yeah.
of a better word,
Yeah.
anecdotes?
It's a real challenge. The power of the anecdote, the power of the story. I like to think about how to use the power of the story for the good. And I use that phrase because I think it's for the good when it's representative of the data and the real level of risk. I think it's a challenge when it's the exception, because there's nothing you can say to that family that was the exception that makes them feel that they did the right thing, because their experience was different. It's why I never went on TV when I was at ABC to debate with a mom about whether a vaccine led to her child having autism, because I know the data, I know the science that vaccines do not cause autism. That mom knows the experience of her child, who she saw as developing normally and getting vaccinated, and then showing signs of autism. And there's no amount of data that is going to convince someone based that their experience isn't real. And I think it's highly disrespectful to get into that kind of a debate. Um, but it's so there's some tension there around the stories, and what you often see are that some who are major anti-vaccine advocates weaponize stories and rare occurrences. And I also think that there needs to be honesty on the scientific side to say, there is a chance of one in whatever of developing a rare heart situation following this vaccine, or there's this. Um, it can be hard to make that feel real for somebody, to say, well, your chances of dying of COVID are this, your chances of having something bad from a vaccine are this. Unless you're an epidemiologist, those numbers don't connect. And the fear that you're going to do harm by getting the vaccine for some can overwhelm the science and the evidence. It's a real challenge. That's where the trusted relationship with a healthcare provider is so important. And what I'll do is I'll say to people, you deserve to have your questions answered by someone who's got the expertise to answer them. And so go talk to your doctor. Tell them what you're concerned about, and make sure that all of your questions are answered so that you can make the right decision for you and your family.
Okay, thanks, Rich. You've um, talked about the importance of sharing stories, and you've had the opportunity to share so many stories, to speak to so many people, sort of living these experiences. You were in West Africa. In communities experiencing the Ebola outbreak. You were in Haiti in the aftermath of an earthquake. I wonder if you can sort of share with us some of the moments from your reporting days that really have stuck with you or were especially impactful.
Yeah. You know, I guess I'll talk about West Africa and the Ebola outbreak of 2014. As I said, I'm an epidemiologist. I'm an infectious disease epidemiologist, and I trained at CDC as a disease detective. And so when ABC sent me to Liberia, um, I had a level of understanding of how you stay safe in that setting that allowed me to bring a camera into settings that other reporters would not have been able to. And so I was able to suit up and bring a camera into an Ebola ward in West Africa, and to meet a child who was in there, scared, but well supported by those around her, because a lot of the people who were getting Ebola and were in the healthcare facilities were healthcare workers. And so um, what it allowed me to do was to put a face on something that in America felt very, very foreign, and to show what was taking place in terms of high level of care in an Ebola ward. And what I tried to do was to help people understand risk. Again, we're in public health, we're often talking about risk, and that the risk in Liberia, where I was quite high. and that people were suffering, and that's where the aid and the support needed to be. I tried to shine a light on the lack of support that was coming in, or the inadequate support that was coming in from the U.S. And reported on that. Um, and then while I was there reporting on this, a man walked into an emergency room in Texas, and he had come from Liberia, and it turned out that he had Ebola. And so I was immediately pulled out from West Africa and sent to Texas to report on Ebola in America. And there, my goal was to try and um, again talk about risk and the low level of risk to people in America. That you don't get Ebola from someone unless they're quite sick and they're displaying symptoms, and tried to hammer that message. I was supposed to, at the time, I was supposed to go be a visiting lecturer at Case Western Reserve University. They canceled my invitation because they said that people would be uncomfortable in the giant auditorium where I was going to give my lecture. And so I wrote an op-ed that was in the Washington Post about risk and real risk and the importance of universities doing the right thing and supporting science and evidence, and that it was a missed opportunity to try uh, and squash the epidemic of fear that was taking place in the United States versus the epidemic of Ebola, which was taking place in West Africa. And this being able to contrast this story, I had gone to the village where the man in Houston, I think it was Houston or Dallas. My Texas geography is bad, but the man who was in Texas was from, and was able to talk about how he had likely become ill. But putting a face on a crisis is really key. You mentioned Haiti, and there was a massive earthquake in Haiti in 2010. And it was just a few months after I joined the network, and I went off to Haiti to report on that. And I remember, the story that stuck with me the most was going into a big square in Haiti that was really a tent encampment. People were camped out there because it wasn't safe to stay in their buildings. There were all these shocks that were bringing down buildings. And I was called to a tent where a woman was in labor, and asked to help deliver her baby. Well, I hadn't delivered babies in quite some time. And it appeared to me that the baby was not positioned in an easy way, was a breech delivery. And so it was a mad scramble to find medical resources for that woman and baby so that she could have a healthy delivery. And it made for good television because it was a story of this woman in need in this crisis, and we were able to get her to a medical facility, a tent hospital where she was able to deliver. But it put a face on this crisis that can be so easy to separate yourself from. It's much easier to have feelings about the death of one or two or three people than when you're talking about thousands.
Mhm.
And one of the powers of journalists is to put a face on a problem, and that's so critically important to get people to connect and to care and to take action.
Mhm. And it requires that people trust you, right? Because they're inviting you into their most vulnerable moments. And so I just want um, to state that it's not easy, I think, to earn that trust, and very easy to lose it. And I think it's remarkable how many of those moments you've been present for, and welcome into to share. Um, I'm mindful of time. We're at 7:45. I just want to remind folks that you're welcome to submit questions in the Q&A. I'm trying to get to as many as we can. We do have a number of students joining us tonight. many of whom are interested in careers in public and global health and medicine, and some science communicators as well. What is your advice for young people today with their careers ahead of them?
We need you. I think that we need people who want to make a difference to go into public health because you can make a difference. And um, don't let anyone tell you that you can't. And public health is something that you can do from many, many different vantage points. As I was saying, I was in academic public health for 5 years and governmental public health, and then public health in journalism, and now public health in philanthropy. There's public health in the private sector. There's all kinds of ways to make a difference when you're thinking about populations and needs and systems and um, uh, go for it. Yes, we're in a challenging time in the United States right now in terms of opportunity. We're seeing lots of losses of jobs in global public health and governmental public health, but they're going to come back. And we're going to need people to rebuild systems that are being torn down. Um, and we need great journalists, people who want to tell those stories because journalism is critically important. As a foundation, we support a lot of work in journalism. And a lot has been around diversifying the media landscape so that we're hearing voices from different communities all over the country. We've helped KFF establish a Southern Bureau to make sure we're getting reporting out of the South. We've funded an investigative journalism program at Howard University to ensure that people with skills in investigative journalism come from a wide variety of backgrounds because your own lived experience is going to drive the questions that you think about asking. I would say go for it and hold people accountable and help make the world a better place.
Ah, thank you. Thank you, Rich. We also had some folks with questions submitted earlier before the talk about sort of just asking for health advice. Asking, first of all, where is a good place to go for health advice today? Given all the misinformation and disinformation floating around out there, but also what is your advice for a long and healthy life? I know that's sort of a two.
Yeah. Well, on the first one, it is really valuable to have a health provider, a primary care provider who you trust, who you develop a relationship with, that you don't wait until you're sick. But if you're fortunate enough to have health insurance and access to a healthcare provider, that you develop that relationship, because that can be a trusted person to turn to say, I'm hearing all this different information. I don't know what to make of it. What should I do? And if hopefully it's someone you trust. Unfortunately, there are, at least in the United States, something like 27 million people who lack health insurance who don't have that, and more are going to be losing health insurance with the policies that are being put forward. In terms of my advice for a long and healthy life, um, if you are fortunate enough to find something you're passionate about and can get paid for it, that's absolutely wonderful. And then finding joy and community and people is so important. Um, yeah, there's the other things that we always talk about: eat right, exercise, get back fully vaccinated on time. That's important. Flu's still going around, COVID's still going around. Those things are important. But in terms of the higher level, finding meaning and purpose is so important. The former Surgeon General Vivek Murthy writes about this and the importance of connection, and I think that is really really important. We lost a lot of that during COVID, and I think that a lot of it hasn't come back, and is so important for well-being.
Mhm. Thank you. We have a good question about how to sort of debunk myths, and I'll sort of broaden that out. I think many of us have now sort of had um, a tough interaction, maybe during sort of peak pandemic, with someone who is sharing false information, and these conversations can be really challenging, particularly if it's with a family member, or a friend, or a colleague. And so, what's your advice for engaging in these conversations instead of sort of disengaging, which might be the more comfortable move for some of us?
Yeah. It's hard. It depends. I mean, to me, it depends somewhat on where someone's coming from. If it's someone who is in that movable middle, who has concerns and may not be where you think they should be in terms of what you know is the evidence, there the opportunity for engagement and steering them towards a trusted source for information, I think is worthwhile. If it's someone who is entrenched in almost the religion of the misinformation, I don't know that you're going to get very far. And it may be that for your own mental health, not engaging on that is the way to go. During COVID, you were saying I did a lot of media, and I did a ton. I really loved the C-SPAN call-in show
Mhm.
because there I would hear from people all over the country. And frequently there were people calling in who disagreed with the recommendations I was putting forward. And it was an opportunity to listen in a respectful way and to try and steer someone towards getting the information from someone that they trusted who might have the expertise and they might be willing to listen to. Um, but it can be tricky to understand, to figure out, is this a conversation I should get into or I should just leave it alone? Because we don't choose our relatives, and you may be able to connect and enjoy each other's company in other ways if you don't go to those, danger zones.
Yeah, yeah, it's very hard. We have another great audience question, um, about how we can build trust. So, first of all, this person is thanking you for the work that you do. Literal lifesaver to many. How can we, as a society, build trust in public health experts, in our doctors? What can we do? Where does it start?
Yeah. Um, Once trust is lost, it is really, really challenging to rebuild it. And a lot, I think, comes out of listening and understanding who the audience is you're engaging with. If the question is coming from a healthcare provider, really listening and being open to what your patients are asking you, what they're thinking, and where their fears are coming from, and exploring that, and recognizing that it may be more than one conversation to get you where you want to be. When I was just starting out as a pediatrician, I felt so strongly about vaccination. It was like I had an approach that if a parent or an expectant parent was saying that they did not want to vaccinate their child, I would say you need to find a different pediatrician because it was that important. Um, as I got a little older, I moved away from that and worked towards establishing a relationship and hoping through that I could help someone move through that relationship of trust. It's a really hard time right now to establish trust in governmental public health because we have political leaders who are undermining it. And what you need during a crisis is for your political leader to be standing right next to your public health leader to be saying what people can do to make the best decisions to protect their health, and the political leader is standing next to them and nodding, and then saying, here's what to do. During H1N1 in 2009, I went from Atlanta to Washington to a cabinet meeting. It was 90, it was 100 days into the Obama administration. And I was there and I briefed the cabinet on what we were doing, what we knew, what we didn't know, the whole approach that I had taken to the press. And after my remarks, President Obama said, thank you for what you're doing. We want to make sure that all that we do is based on the best science available. And I took that message back to CDC and to the Emergency Operations Center, and there was just loud applause because that's what you need to see in a crisis. And the question is, how do we get back to that where there's alignment between our political leaders and our public health community so that people's lives are improved, and in the midst of a crisis, people are more likely to do the right thing. Um, and maybe some of the folks on this call who are looking to go into public health will be able to solve that.
Mhm. Mhm. That this is a nice segue into my last question where we're wrapping up here. I want to circle back to your public message reaffirming the Robert Wood Johnson Foundation's mandate. You say the onslaught of attacks is intentionally chaotic, disorienting, and divisive. Yet we've seen this all before. And you go on to describe the civil rights movement and work by women and members of the LGBTQ community and allies to marshal enduring resilience and strategic defiance to confront and overcome the assaults on our health and well-being. At a time when it's so easy for us to feel helpless, what gives you hope?
Well, I'm I've become a student of history as an adult. In history, I was never taught the history of racism in America. And as I dive in, I see the power of resistance to push back. I'm reading a book now by Carol Anderson called White Rage, and she wrote it following a piece she wrote for the Washington Post when Michael Brown was killed in Ferguson, Missouri, and she talked about what this represented. And then she's a historian. She wrote this book looking back at our history and what had happened whenever there had been progress made around racial justice in America, and you would see this kind of backlash. And what it allows me to do, and I encourage others to look back at history, is see that this was expected, and that resistance can work. And we're seeing legal resistance that's pushing back, that is slowing things down in the court. But we need to continue, and we need to be firm and recognize that resistance is good for the nation and it's also good for the soul. Because if we remain true to our values, that's something that no one can take away from us, and we will win.
Rich, I cannot thank you enough for sharing your time with us tonight. And it's just been such a pleasure. It's so great to see you. I miss you. But
Likewise.
thank you all for joining us tonight. And I hope you've enjoyed this conversation as much as I have. There will be a recording shared. Feel free to share it with friends and family. There will also be, we would love your feedback, so there will be an opportunity to tell us, to share your thoughts with us. Thanks again for joining us tonight, and Rich, all the best to you and your family. Thank you.
You as well. Thank you so much.